The RN test plan has been available since January of 2019 and will become effective on April 1st of 2019. There are three main purposes to the test plan. The first purpose is to guide the candidate who is preparing for the exam. The test plan is an additional tool candidates can use when studying to have a better understanding of how the exam works and what content may appear on the exam. The second purpose is to provide direction for item development. The test plan is consistently used by staff at NCSBN and Pearson VUE, as well as in the item writing and item review panels.
This is why I taught you about the clinical judgment model, because that's new and they're going to implement it for sure in 2022 when they change the NCLEX again, but I literally think that they're using it now. So it's important that you understand how to answer questions according to the clinical judgment model.
The third purpose is to facilitate classification of exam items. In order for the exam to run as it should, all items must be placed into one of the 8 test plan categories. The test plan assists in appropriate item classification. Overall, you will see very few changes to the NCLEX-RN test plan. The changes that do occur are in the form of minor editorial changes, such as a few edits to the list of activity statements.
See, I've always said that. So don't think to yourself, oh my God, the NCLEX has changed. See, overall, the format is retained. Minor edits. They even said that. So for those of you having anxiety issues, oh my God, the NCLEX has changed. I want to take the NCLEX before it changes. First of all, it's June, so it's already changed, so don't worry about it. But also, don't worry that there's been changes. Just calm down, minor changes.
This is a side-by-side comparison of the 2019 and 2016 test plan client needs category percentages.
Okay, this is 2019 changes. So as you can see, there is none, but for those of you that can't read it because the screen's so small, management of care, 20%. Safety and infection control, 12%. Health promotion and maintenance, 5%. Psychosocial integrity, 9%. Basic care and comfort, 9%. Pharmacological and parental therapies, 15%. Reduction of risk potential, 12%. Physiological adaptation, 14%.
These percentages represent the amount of corresponding content distributed during each NCLEX administration.
So the main,
as shown here, the client needs category percentages remain unchanged
content
from the prior
area
test plan.
Is management of care. And safety and infection control.
Here is the same information.
And that's
in
why
a
I focus on those areas the most.
As mentioned,
when I tutor.
The 2019 RN test plan contains no changes in client needs category percentages. Four activity statements were added to the test plan based on SME panel recommendations.
Okay, I'm going to focus on these when I tutor.
The first addition,
let me just stop
provide
this here.
care.
This is going to be a new category of tutoring. If you want me to tutor on these specific changes, just say, hey Garrison, can you tutor me on the specific changes? And then it'll only cost you 1 tutoring session. Okay, you don't have to buy all the tutoring sessions. If you want just the specific changes, let me know that and I'll tutor you on just the specific changes. It's only going to be 1 hour.
For a client experiencing grief or loss. This was added to psychosocial integrity. The second statement was handle and or administer high-risk medications. This was added to pharmacological and parenteral therapies. The third statement was manage client during a procedure with moderate sedation. This was added to reduction of risk potential. And the fourth statement was maintain percutaneous feeding tube, which was added to reduction of risk potential. Two activity statements were transferred to different test plan categories based on
This was
SME
not
panel
added. It
recommendations.
just means they transferred it from
The first
management of
was
care,
report
for
unsafe
example,
practice
to
of
safety
healthcare
and
personnel
infection control.
and intervene
No
as appropriate.
new information.
For
They
example,
just
substance
transferred
abuse
the
and
information.
proper care staffing practices. This was moved from management of care to safety and infection control. The second was apply and or maintain devices used to promote venous return, for example, anti-embolic stockings or sequential compression devices. This was moved from basic care and comfort to reduction of risk potential. To review the new 2019 RN test plan and 2017 practice analysis, please visit the link above or visit the NCLEX section of the ncsbn.org website.
I will put the RN test plan, the new one. I'll also put the LPN one. So pass this along to your LPN friends. I'll put the test plan for both the RN and the LPN test plan in the description.
The 2019 RN test plan can be found under the Test Plan tab, and the practice analysis as well as additional statistical data which may be of interest can be found under the Exam Statistics and Publications tab.
All right. I think that's the end of the video. So thank you and have a blessed day.